Welcome back to another fabulous episode of Healthcare Trailblazers. I am very excited to be sitting here today with the wonderful Dr. Chinni Pulluru of Walmart Health. Walmart Health has been a fascination of mine since Dr. John White, the Chief Medical Officer of WebMD. We had a great chat with him, and I had asked him for some interesting, up-and-coming, exciting, innovative, companies in healthcare that were kind of on his radar. And he said, actually, I just got a tour of Walmart Health, and I'm really fascinated with what they're doing. He suggested that we sit down. So fast forward a couple months, here we are. I'm excited for this conversation. Walmart Health makes a lot of sense to me in theory. I'm excited to find out from you what it actually does. But just conceptually thinking about the giant footprint that Walmart has all over rural America. I grew up in a tiny little town in Iowa, and Walmart was the store. It was where you got, it was where you got everything, and it's where we, went on trips to walk through the aisles, and it was just everything was at Walmart. So to leverage that and use it to bring healthcare to some of these rural communities seems like it makes so much sense. So not to get ahead of myself, Dr. Pulluru, thanks so much for sitting down with us today.
Oh, thanks for having me, Mendel. It's a pleasure.
So talk to us about, let's first talk about you a little bit. Talk to us about your upbringing and what got you involved in healthcare, and then how did you make it over to Walmart Health?
Definitely. So I grew up actually in India. I came here when I was 8 years old, and then grew up in a small town in Michigan, Battle Creek. And what got me into healthcare, my dad's a doctor. And I think the thing that, so of course it was sort of a way of life in our household, but the thing that really motivated me was I grew up going to rural India with my dad and watching him take care of patients, and patients who didn't have anything. He often did it for free, didn't really ask anybody for any sort of reimbursement for his services, but he took care of large villages and screened them for disease. Long story short, I grew up doing that, and it really impressed upon me sort of a desire to help underserved communities and to use my upbringing and the privilege that I had being his daughter to bring that to bear. So medical school, residency, grew up professionally in the suburbs of Chicago in a large group. Worked for 15 years building a practice, went through 2 private equity acquisitions with that group, really lived in value-based care. That's what was my passion. Found myself 2019, I left that group and really started to evaluate what I wanted to be my contribution in healthcare, and found my way to Walmart. What really attracted me about Walmart was the mission of living, helping people live better lives and helping communities that don't have access to healthcare, don't have access to things that we all take for granted, and the platform that it has. So came to Walmart a couple months before COVID actually hit, and helped with the COVID response. But that year that we were getting testing sites built out, helping people get vaccinations, taught me a lot about the trust that Walmart enjoys in the communities that it has, as well as how healthcare can be reinvented, right? In COVID, we had to reinvent healthcare. We had to figure out how to get it to people who couldn't access it otherwise. And so currently I'm helping do that on the Walmart Health side with leading the expansion of both the Walmart Health clinics, redefining what care can potentially look like, and integrating our Walmart Health virtual care services within our enterprise.
Love it. And we've definitely at Proviva Health Group, we have clients in rural America, and we had some people that head up various rural health organizations on the podcast as well. And it's something that people that live in the big city don't appreciate, the hardship that being in a really rural area brings to specifically healthcare. It's underserved areas, a lot of them. And then you're like, oh, well, great. Well, now we don't need doctors there because now we have telehealth. And it's like, well, they don't necessarily have Wi-Fi. So that's a whole nother issue. So again, just thinking that how wide Walmart's footprint is across rural America, makes so much sense. So was Walmart Health born out of COVID, or did it start before that?
Oh, it started much before that.
Okay.
The original concept of it has been in the works for many years.
Hmm.
We opened our first clinic in September of 2019, so pre COVID. Our second clinic opened in January of 2020. So the drive to bring healthcare to communities that didn't have it is something that was a mission long before COVID existed. Now, COVID put a microscope, put basically a microscope on the inequity that exists in America. And at Walmart Health, we found ourselves thinking of how we could be much more of a solution than even what we originally thought. And I think COVID also accentuated how we connect the dots, right? How healthcare can interact with pharmacists, how community health workers can play a role. And so that's something that we're really proud of at Walmart Health, is our integrated care model. We have physicians, nurse practitioners, dentists, optometrists, as well as hearing specialists and LCSW, behavioral health folks. And then we embed all of that in a community healthcare model. So we have community health workers who really interact with our patients to be able to connect them to resources they wouldn't otherwise be able to access.
Got it. So, but yeah, so it was obviously, I mean, especially for an organization the size of Walmart, in order to open up in 2019, it's got to be having planned for quite a long time before that. So obviously the conception was going on for quite a while, but even your first clinic opened up 2019. That's not that far before COVID. Second clinic during COVID. So, and then like you mentioned, COVID had kind of a really formative impact on Walmart Health. So let's go through, let's bring ourselves, I know hard as it may be, let's bring ourselves back to the beginning of COVID. There's chaos, everyone's locked in their houses or apartments. I was in New York at the time, everyone's locked down. What was the role of Walmart? I know it was a huge role. Walk us through how Walmart took us from just being Walmart to everyone knowing that they can go get a test, go through the parking lot, all that. So what was Walmart's role during COVID?
It was pretty awesome and awe-inspiring to see. So first of all, we found ourselves being put in the role of actually being first responders, right? People needed food, they needed groceries, they needed household items. And I always told people that there's hospitals stayed open during COVID, but Walmart stayed open during COVID. And we found that the people in Walmart, our associates, were frontline workers. So the biggest, the thing we took so seriously was how do we protect our associates and how do we protect our customers? And when COVID first hit, right, we didn't know. We didn't know how it was spread. Things were changing on a daily basis. It was a
Yep.
really charged atmosphere. And so we took it upon ourselves to do everything from figuring out all protocols to protect our associates. That turned all the stores into healthcare entities, and that turned our pharmacies into how do we play a part of protecting not just our associates but the consumers. And then when we were approached by the government to help in testing and to help get testing out there, we were challenged with how do we open testing sites. And within 1 week of Doug announcing that we were going to be helping on the White House lawn, we had our first testing site stood up. Within 2 months, we had 600 testing sites. We iterated on that to make it drive through and all kinds of variations of testing. And this is, April, May, June, in the middle of COVID. We also took our job seriously in educating consumers, educating our associates, because as you said, in many small towns, our associates are such a part of the community. Each store has hundreds of associates. If you take them and their families, they're a part of the community. And so we felt that we needed to have a responsible role in educating people about testing, about the vaccine. The other thing that we did is really look to pivot our over the counter offering to being able to deliver home testing, to being able to provide home testing, right? We were leading in the industry in being able to not just provide it, but deliver it. We even did some drone pilots on how do we deliver testing in a touchless atmosphere. And so,
I remember that.
really innovated and iterated. And then on the Walmart Health side, we thought about, how we wanted to be defined as a healthcare entity that stayed open, that didn't close their doors. We knew people needed primary care. We also knew people needed a place to go for urgent care. People still fell and had cuts and other things that they
Yep.
needed for urgent care. as people were being employed, they needed drug screens and DOT physicals. We needed truckers in this country, right? And where were they going to go for their DOT physicals? So there was all this stuff that we felt we needed to provide. And we actually found a way to do it safely. We re engineered our spaces, we redesigned everything. We had gaps between appointments so we could open up, we could clean in time. I mean, it was pretty cool to be able to look at our enterprise and say, how can we be a solution to what the country needed? Even our optical centers, we closed them down for a period of a few weeks. We fit tested all of our optics and we reopened them safely. We had all these protocols put into place. So when people needed, we thought about, well, what happens to an elderly person who broke their eyeglasses and couldn't drive because they didn't have eyeglasses? Our optical centers were open. So really cool way that the company, I feel, responded throughout all of its assets, including its healthcare assets.
Yeah, and taking while we're talking, I'm taking myself back to that time, and I have like now that you mention it, it is an incredible feat for an organization the size of Walmart. The alacrity that you guys had and the ability to pivot so quickly. Obviously, staying open. I know there was a huge role that Walmart played in the testing rollout. I actually recently finished Jared Kushner's new book, Breaking History, which is great read, highly recommend. And of the big leaders that the president called and said, do I have you on board? And it was absolutely whatever you need. Walmart obviously played a huge role, but even pivoting so quickly, I mean, just in one day, the parking lots transformed where there was an entire section that was out for, pickup and touchless, and everything just transformed so quickly. And I think for an organization of Walmart size, that's actually really fascinating. How there's got to be some secret sauce in the communication and the messaging that you guys have up at the top. I mean, you're VP of clinical operations, so you're obviously very impactful there. How do you think you guys are successful at communicating so effectively that within days, if not a day, if not hours, a message and an action can immediately transform into action?
I really feel the company's secret sauce is its culture. As someone who came in from the outside, I'm 3 years in. I'm sort of a veteran in the healthcare world, but I'm very much a newbie in the Walmart world because we have 30-year-old and 40-year-old associates who, so Walmart is one of those companies that people come to work and they stay and they progress through the company. But, the secret sauce to me and something that just on a daily level really astounds me is the culture. And the culture allows for the company to be extremely mission driven. Very much it's about the customer and it's very much about a service. We serve our communities, we serve our associates. And even at the home office level, corporate where I sit, we think about ourselves as being in service of the community. And it starts at the top, it starts at our CEOs, John Ferner, Doug, Judith, Kathleen, who lead us. When you see them tour the sites, they often ask, what can we do to help you? How can we make your life easier to our associates? And I think that flows all the way through the organization, and it lends itself to a level of agility that you rarely see in organizations, right? And people are encouraged to sort of come up with good ideas, execute on them, invent them. In fact, my favorite story is that those plexiglass shields that were in pharmacies, we were probably, I believe we're the first to put those up in pharmacies. And it came from a pharmacist or a farm tech in the field who, on one of our broad based calls, said, hey, we'd really love to have this to protect ourselves, in case it is spread by certain types of bodily fluids, which we didn't know at the time. And within 3 to 4 weeks, 5,000 stores had those put up in the
That's
stores. So talk
madness.
about our realty team, right?
That's
Being
madness.
able to and I remember looking at pictures of those. I remember someone actually coming to me one morning and said, Dr. Chinni, this is how we're thinking of doing it. Do you think this is enough? Do you think the height's enough? And once we looked at them and said, yeah, these look great, as a group, within weeks, 5,000 pharmacies had them. And that's Walmart,
It's
and
crazy. And 5,000 pharmacies isn't 5,000 pieces because each pharmacy has multiple. I mean, just the production of that is incredible. So let's zero in on Walmart Health a little bit specifically. Let's talk about the trust that the community clearly has in Walmart, why you think that is, and how that translates over into health.
So, we live within 10 miles of 90% of the United States population. Every week, most of this country steps foot inside a Walmart. And so you think about that happens over and over and over again. Over the course of Walmart's history, it has found a way to earn the trust of the customers that come in and walk in through the door. But you look at where we're located, 4,000 out of 5,000 Walmarts are in HRSA medically underserved areas. A huge percentage of our sales go to the highest social vulnerability index. And so we're in communities where people, A, don't have healthcare access as defined by HRSA. We're in communities where people are socially and vulnerable to health outcomes. And so that gives us a license to really be in the healthcare space trying to help people live better and healthier, right? And if you look at the prevalence of diabetes in this country and where Walmarts are located, it's almost like the exact same map. And so think about what we can do if we bring healthcare to consumers and help lower the barrier to access, right? So people often ask me, "Well, how are you guys innovating?" I look at them and I said, you know what? We're innovating by providing access. It seems simple, but it really, that's what it is, because there is no quality without access. There's no trust without access. And so, it's the trust that people walk in through the door that you will be there for them is how Walmart has defined itself on the store side, and I believe how we're defining ourselves on the healthcare side.
Incredible. So Walmart's obviously not looking to get into healthcare because it sees a great business opportunity, because that's not what that's not what healthcare is for the most part. And it's clear from I think your actions most of all, and definitely from talking to you, that you guys are looking to be different. And you just talked about a huge differentiator is bringing it close to home, bringing it to these underserved populations. I think the stats that you mentioned, I hope people didn't glaze over them, because that's actually an incredible some incredible statistics of the one that you said about diabetes being an exact footprint as Walmart. I mean, mind blowing. Being able to be within distance of 90% of America is something that no other company, I think, can say. So besides for that, I mean, that's a really big differentiator. So you kind of already started answering my question, but let's move into value-based care. You guys are building in a value-based way. That can mean a lot of different things to different people. What does it mean to you and to Walmart?
It's simple. So, value based care for us is providing high quality health care in a manner that provides access and is of economic value to both our patients and those that pay for their health care, right? So whether it be government, private employer, or our patients themselves, we want to provide value health care for everybody. So value based care in our mind is really A, getting the patient in, B, taking care of them in a holistic manner. And the last is embedding health equity concepts into every part of their healthcare. So, looking at social determinants of health, making sure that we don't just collect the data, but we react to the data. We help patients. 1 out of 4 grocery dollars is spent inside a Walmart, and we are the largest producer of fresh organic food in a grocer in the country. And so we have made it a commitment for us to help our communities eat better, right? And eat healthier. But in healthcare, that's a social determinant of health. And even just simple things like broadband. We have places where people don't have broadband access. And being able to provide telehealth or being able to provide telehealth inside a store maybe could be a differentiator for places that don't have broadband access. And so think about the way that we could potentially impact the community. To us, that's all value based care. It's basically helping people live better, healthier lives, but also Walmart, our mission is to help people save money, right? Stretch their dollar further. So
Save
they
money,
can,
live better.
yeah, I mean, save money, live better. It's simple, but stretch their dollar further. Every dollar they don't spend on healthcare, they can spend on living their life. Every dollar that they save money on for their medications is a dollar they can spend on their children.
Yeah. Yeah. So that's interesting. So there's areas, Walmart obviously has broadband, but nevertheless, there's areas within small, short distances of Walmarts that don't have. That's interesting. I wonder why that is. I don't
A
know.
lot of people can't afford it. And most of the, there's parts of the country that aren't covered.
Right. So that's what I'm talking about. Affordability, I understand, but as far as the actual network. But let's talk about prevention. So this might be completely wild, but when I heard Walmart Health from Dr. White, my mind went in a very exciting spiral. And one of the things I thought was exactly what you mentioned. Obviously, huge fresh produce. You guys have everything. You guys have fruits and vegetables and everything that Walmart superstores carry. And I was like, wow, imagine, obviously you guys have the app. I'm a big user of the Walmart app. Love it. Very good user experience. I was like, wow, imagine if, because when you talk about diet, which, a huge part of preventive care, focusing on healthier lifestyle and healthier food choices and things like that. And I was like, imagine if Walmart integrated with their app where, it would, is I'm not okay. I'm not going to give you the answer. Let me ask in question form. Is there any integration between the Walmart Health side and the actual Walmart side?
So Walmart Health is independent, the medical provider side. So they're independent medical providers who provide care, supported by Walmart and Walmart Health supportive services as well. So we are looking at ways that we could integrate and be legally compliant in integrating. Right? There's complexity to healthcare delivery that you have to be careful in how you integrate, and you have to make sure that you do it in a way that is respectful of people's privacy and patients' privacy and patient choice. So those are things that we're looking into right now. But we do believe that there is a world where, with the patient's choice, we can potentially integrate their health care across various continuum of health behaviors. And how, as you know, health behaviors determine the vast majority of your health outcomes more than even your genetics. And
Yep.
so really important that we do that, because we can help people then, you know, have a better diet. We can help people ensure that they're getting activity. We can help them with other healthcare needs they have.
Yeah, absolutely. I think there's a lot of. I think obviously your present work is fascinating, but I think the future iterations of where you're going to go with this is going to be astounding. Let's talk about the continued rollout of Walmart Health. So I understand you guys are rapidly expanding across a number of states. I think Florida is one of the highlights. Talk about the expansion through Florida a little bit.
Yeah, so this year we opened 6 sites in Florida across 3 cities: Jacksonville, Orlando, and Tampa. We picked these cities because, Florida is obviously one of the largest growing states by population in the United States, but it's also one of those states that has the lowest physicians per capita that are providing primary care. And we felt that it was a great location for us to be able to provide primary care, but also get into value based care and really look at how do we focus on our senior focused populations. So next year we're going to be opening 17 more sites. Super excited about it. Spread across those 3 cities and their larger metropolitan areas. But so that's, by the end of next year we'll have a very large presence in Florida. Super excited. Can't wait. Think that our communities are already showing us that they trust us. They're already walking in through the door. They're showing us that they want to be seen by us, and furthering that trust and furthering that relationship in more communities across those cities is something that just excites me. I'm a Floridian. I actually moved to Sarasota this year, and so super excited to bring Walmart Health to Florida.
That's so cool. So what does the patient experience look like, and is there any difference besides for the convenient location? Is there any difference in the actual clinic patient experience than what people are probably used to?
I think the biggest thing you'll see when you walk in through our doors is when we say we're consumer centric or patient centric, it isn't just a platitude or words, right? You'll see someone walk up to you and say, "Welcome to Walmart Health. How can we help you?" And you'll see a lot of our Walmart Healths or all of our Walmart Healths are very centric to the community that they're in. We make a big effort to hire our community health workers as well as other, including providers from communities, or we want people to look, act, and feel and understand the community that they work in. And that's really important to us. So being culturally sensitive. So even when, say, you recommend a diet, right? it makes a difference. I'm Indian, so it makes a difference when I'm speaking to someone who's Indian, who I can understand that, boy, they eat a lot of rice. And I can suggest, well, instead of eating, I know you eat a lot of rice, but instead of eating this, maybe you can eat something different, or and actually offer a substitution. So that's what we're hoping to bring, and that's what we're working to design, is
Mm-hmm.
is a consumer centric, where we help you by being just friendly, right? Just walking up to you, looking to serve you, saying yes, we can serve you. And then after that, designing for health equity, designing for communities that have diversity. And the lastly, providing access. We're open on Saturdays, we're open late hours. We provide telehealth, on all 7 days. We have behavioral health services. So providing access. And lastly, which I think is actually really, really important in the healthcare world now, is decreasing the complexity of medicine for people. We have patients that have health insurance that don't go see doctors. They
Yeah.
walk into a Walmart because they trust Walmart. And when they start talking to you and you ask them, I've sat many times in a lobby and asked patients, why did you choose us? They they are hoping that we can help them decrease the barrier of understanding,
Hmm.
that we can help them decrease the complexity of medicine. And it's really, really important to them that Walmart can provide that. Because so I think that there's, medicine has made itself so complicated to patients that even highly people who are in the healthcare world, highly educated in healthcare, can't make a doctor's appointment properly,
Yeah.
can't access medications, don't understand their disease.
Yep.
Think about people who aren't in healthcare. And so I do see our role as also simplifying healthcare for people.
Once again, mission driven over at Walmart. Absolutely fascinating. It's so nice to talk to you. Like I said, I've been excited about this conversation for quite a while, and I know there's so much that we didn't cover. I know Walmart's got a partnership with Medscape, and they're constantly either acquiring or partnering or working on some level with various different interesting initiatives in healthcare. For everyone listening, there's going to be links all over, depending on the platform, up or down or sideways. Go check out Walmart Health. Keep an eye out for what they're doing, you guys. I'm very excited. I think that what you guys are doing is really incredible. And I think that it's clear in the results that you've achieved thus far that your mission-driven method of communication and really getting things done is really commendable. There's a lot of people that like to whine about healthcare. And so for Walmart to come in and say, we're good, we're fine, we're very successful at selling things to people, and for them to say, no, we're going to start this new initiative is I think commendable and something to look out for in a very good way. So Dr. Pulluru, thank you so much for spending time with us today.
Absolutely. Thank you for having me, and thank you for what you do.